now I've got this interest, is Kate Kavanagh starts to say that you can actually use AI to deliver common factors. What we think is so important about the therapeutic relationship, it can actually be delivered through AI, through machine learning. And if we can crack that, then by all means, we can take and revolutionize low intensity. There's ecological momentary assessment, where actually the person is able to use the app and the functionality of the app at the time that they actually need it. So if they notice their stress and anxiety start to inflate, they can start engaging with the app at that moment in time. So really it's taking the therapy to the person, to the time the person needs it. These are some areas around smart personalization. You can tailoring of apps or CCBT systems. We know that if you tailor the therapy to the population, it's more likely to be engaged with, it's more likely to be effective. I developed low intensity CBT and engaged it for armed forces veterans. And now it's called a hidden wound service. Low intensity, culturally very acceptable. A lot of armed forces veterans very much like the idea of helping themselves. So low intensity is very, very acceptable to that as a population, and those studies are going very well. Smart personalization is effective in improving outcomes. We know if you use smart personalization. And if I started to understand a bit about this Iona company, the machine learning, they're using it to replicate the support role. So they've identified through their big data that less emotionally expressive users are more likely to benefit from behavioral interventions. So as far as I understand, if someone is identified as less emotionally expressive, their big data highlights that they should be directed towards behavioral rather than cognitive interventions. And the treatment plan in those cases starts with behavioral activation. This is doing exactly what a low intensity or high intensity therapist would do. This is what they've built into their system, as I understand. I'm not an expert in apps or mobile tech, that's not what I do, but I'm just really impressed with what they're trying to do. So they detect momentary changes and tailor the interventions in terms. And there's growing evidence that these just-in-time interventions go through a process of analyze, learn, and adapt. So you see this machine learning. And they also learn the time of day through machine learning. That patient is more likely to experience changes. And then they can send notifications through the app to actually check in with the patient at that time. So treatment is almost becoming 24/7. So in terms of the digital interventions, we are combining AI to maximize the potential for mobile. And we're facilitating what works for whom, and we're helping to dismantle interventions. So we're identifying, potentially like the brief CBT, the Premier League CBT therapists, we're recognizing and we're able to cut the corners to get to the core of the problem, potentially through AI, rather than having to do the protocolized 16 to 20 sessions. And we have real research potential here, as I see it. The apps can collect big data. I think Iona said they had data on 40,000 users. And if we think, I was involved in COBRA, which is one of the biggest gold standard randomized control trial, I think we had 450 and we were all patting each other on the back and congratulating ourselves. I know that was a gold standard study, but potentially getting data from 40,000 people is telling you a lot as well. We can validate the effectiveness for MCBT in clinical practice. This needs to be done. I'm a big fan of where apps can go, although I have yet to see that. But we need to validate the effectiveness. And research should also improve and focus on usability and adherence alongside effectiveness. So we need to broaden the research potential. So I know Washington is a very research active university, as indeed Exeter is. There's lots of research potential in this arena.